Techniques to cope with anxiety during coronavirus for people living with cancer. We spoke to Paul Dalton, Principal Clinical Psychologist at St Vincent's Hospital and Associate Professor of Psychology at University College Dublin, about coping techniques that may help at this time.
People who are living with cancer tend to be a little bit more anxious than most, understandably, and feel a little bit more vulnerable in the world at the best of times. They tend to have to take precautions, hygiene, diet, generally minding themselves at the best of times. And now we find ourselves in these completely unprecedented, fear-inducing times, and our stress volume is turned up. The important thing to remember is that this is completely normal. Anxiety is a normal response to an abnormal situation, and we are in an abnormal situation. It is to be expected that we would be more worried, more frightened, scared. But there are things that we can do to help. There are things, particularly people living with cancer and beyond cancer, and their families can do. We have a responsibility at this moment to help ourselves, to manage our minds over the next period of time, to manage these minds. What's going to get us through is how we manage our minds and our hearts.
Dr. Dalton said, the best way to ensure we are working to manage our minds is following the acronym FAST. F-A-S-T. F. Focus on what we can control. At times like this, we can feel very much out of control, which can lead us to feel hopeless. This is understandable and can be countered by focusing on what you can do today, according to Dr. Dalton. This includes focusing on following official advice around good hand and respiratory hygiene, employing social distancing, and keeping the house clean. It can also be helpful, Dr. Dalton suggests, to widen our lens and focus on what we could be doing to help others, such as reaching out by phone to our friends and family to check in. A. Avoid unreliable information and continual updates. There is an unrelenting stream of information coming at us at the moment, both reliable and unreliable. Dr. Dalton is urging people to employ a 20-20 approach, where you take 20 minutes to inform yourself about what is happening in Ireland and around the world from trustworthy, reliable sources, and allow another 20 minutes to discuss the latest information. But beyond this, Dr. Dalton says we should be avoiding constant updates and being disciplined about this. It is also incumbent on all of us to consider what we are sharing on social media.
Sharing unreliable, sensational and inaccurate information is fueling our anxiety and the anxiety of others.
S. Seek safe support. Identify the social support networks you rely on and ensure that you are using them safely, such as via technology.
We know from all of the research across the world that humans don't cope very well when they're isolated. It's really challenging. As we move on, particularly for people living with cancer and their families, it's going to be crucial for people to maintain social support. There are all sorts of ways that technology can accommodate, such as FaceTime and Skype and Zoom. I've heard of people arranging coffee dates over Skype. You can also explore safe outdoor activities such as walks, once social distancing is being safely employed.
T. Take a breath. It is crucial to partake in an activity that allows you to take a breath.
We will find that we forget to breathe when we're anxious. We're actually doing something every day to help settle the nervous system is really important.
There are a number of resources for breathing exercises and mindfulness online. As well as employing the FAST approach, it is vital that people also ensure that they are looking after the basics of sleep, exercise and diet.
It's really easy to let go of all the good things that we do to look after ourselves when our routine is upset. Another really important thing to watch is alcohol intake. It can really creep up at a time like this. Also, it's really important to watch caffeine. Caffeine is a stimulant and will increase our anxiety. People should be eating well, looking after your diet, and getting exercise. Practicing good sleep hygiene is really important. Leave your phone in another room, no TV or other devices an hour before going to bed. Sometimes these fundamentals can get a bit unsettled, and it's important that we ensure we are looking after the basics. Really important.
If you are caring for a loved one who is affected by cancer, encouraging them to take the fast approach outlined in this video will help ease their anxiety, but it is also important to look after yourself.
You can't drink from an empty cup, and as carers, we get depleted. So that's why it's important that we really try to nourish ourselves at this very important time.